Ever pondered what triggers low blood pressure? Hypertension or low blood pressure can be attributed to a diverse array of causes. Here are some of the most common ones. Orthostatic hypotension is one such cause. It occurs when a quick transition from sitting or lying down to standing causes a sudden drop in blood pressure. This is due to the body's inability to swiftly increase blood flow to the brain. Central nervous system diseases such as Parkinson's disease can also lead to low blood pressure. This occurs as these conditions can disrupt the nervous system's control over blood pressure. The effects are particularly noticeable after eating, when the digestive systems require more blood to process food. A reduction in blood volume can cause low blood pressure. This can result from severe injuries leading to blood loss or dehydration. Life-threatening conditions are also potential catalysts for hypertension. This includes irregular heart rhythms or arrhythmias, pulmonary embolism, heart attacks, and collapsed lung. Severe allergic reactions or immune responses to severe infections can also lead to low blood pressure. Heart and lung conditions can also trigger low blood pressure. Hypotension can occur when the heart beats too quickly or too slowly, or if the lungs are not functioning properly. Advanced heart failure is another potential cause. Prescription medications can also lead to hypotension. Medications used to treat high blood pressure, heart failure, erectile dysfunction, neurological problems, and depression are among those that can trigger low blood pressure. Alcohol or recreational drugs can lower blood pressure, as can certain herbal supplements, vitamins, or home remedies. This is why it's vital to disclose all substances you're taking to your healthcare provider. Pregnancy can cause orthostatic hypotension, particularly during the first and second trimesters. Pregnancy complications can also lead to low blood pressure. Extreme temperatures, both hot and cold, can affect blood pressure levels and exacerbate the effects of hypotension. Low blood pressure can lead to complications such as falls and related injuries due to dizziness or fainting. It can also cause shock, organ damage, heart problems, and stroke. Diagnosing hypertension is straightforward and involves taking a blood pressure reading. However, identifying the cause of hypertension requires a healthcare provider to conduct various tests, especially if symptoms are present. In conclusion, low blood pressure can be caused by multiple factors including central nervous system diseases, low blood volume, life-threatening conditions, heart and lung conditions, prescription medications, alcohol or recreational drugs, pregnancy, and extreme temperatures. It can lead to complications such as falls, shock, organ damage, heart problems, and stroke. Diagnosis is simple, but identifying the cause requires a thorough examination. Remember, knowledge is power, and understanding what causes low blood pressure can help in managing and preventing its complications. How is low blood pressure treated? The path to treatment often begins with identifying the root cause. When a direct cause is found, such as an injury with blood loss, the treatment is straightforward. Repair the injury and replace the lost blood. Should medication be the culprit, a healthcare provider might adjust the dosage or cease its use. However, when the cause of low blood pressure remains unknown, the treatment takes a different route, focusing directly on the symptom rather than the cause. The ultimate goal in these situations is to manage the hypotension, with a cure only possible if there's an underlying treatable cause. Treatment options can be as simple as intravenous fluids or as complex as surgery or a heart transplant. Direct treatment of hypertension typically involves one of three strategies: increasing blood volume, causing blood vessels to constrict, or altering the body's fluid handling, the latter of which involves medications that encourage the kidneys to retain fluid and salt. In addition to medical treatments, healthcare providers may recommend lifestyle changes such as increasing salt intake or learning to recognize and respond to hypertension symptoms. The exact complications or side effects of these treatments largely depend on the specific medication or treatment method and the individual's unique circumstances. Therefore, it's vital to discuss these potential outcomes with a healthcare provider. The timeline for feeling better post-treatment varies widely. While some might experience immediate improvement, for others, it could take days or even weeks for the treatments to yield consistent results. Prevention of low blood pressure is not typically possible except in scenarios where known triggers such as certain recreational drugs or supplements can be avoided. Dietary changes, like eating smaller, low-carb meals, may also help prevent drops in blood pressure after meals. In summary, the treatment of low blood pressure begins with identifying the cause. If the cause is known and treatable, the low blood pressure can often be resolved. If the cause is unknown, the focus shifts to managing the symptoms. Treatment methods range from medication adjustments and lifestyle changes to more drastic measures like surgery. The timeline for improvement varies, and prevention is often limited to avoiding known triggers.